Hey guys, this is your pharmacist Sidra, and welcome to another lesson of Pharmacy Tech Study Guide. In today's lecture, we're going to learn the concept of therapeutic equivalence, its significance in pharmacy practice, examples, the Orange Book reference, and criteria for determining the therapeutic equivalent drugs, and much more. So stay tuned till the end of this video. So you get a customer at pharmacy counter who tells you that the doctor recommended them to get some Tylenol over the counter to help with fever. You direct them to the relevant aisle, but the customer comes back to you all overwhelmed saying that there's so many rows after rows of options and they don't understand which Tylenol to get. So what do? You go to the aisle and see there are so many brands of Tylenol. There are tablets, liquid gels, capsules, time release, slow release, liquid. But not only that, there is brand Tylenol versus generic Tylenol with the same active ingredient, acetaminophen. And so, really, which one to get? It's all confusing, right? So, well, this is why, as a pharmacy technician, you need to have a clear understanding of therapeutic equivalent. Patients rely on pharmacy personnel to provide them with safe and effective medications and their alternatives. Now, by understanding which medications are therapeutic equivalents, we can confidently help them with the medication substitution, which will provide the desired clinical effect without compromising safety and also breaking the bank. Now, think of it this way. In some cases, patients, let's say, may request or be offered a generic alternative to their branded medications due to cost consideration or, let's say, insurance coverage. So, as a pharmacy technician, you need to understand which medication can be safely substituted to another one to meet the patient needs without compromising quality of care. All right. Now that we know why it's important for pharmacy technicians to understand the concept of therapeutic equivalence, let's elaborate it, define it, and move further. So, definition of therapeutic equivalence. Therapeutic equivalence refers to the similarity in clinical effects and safety profiles between two drug products which contain the same active ingredient and are intended for the same use. In simpler terms, it means that two drugs, whether brand or generic, are expected to produce the same therapeutic effect when administered to the patient under same conditions. Now, according to FDA, there should be no clinical difference between the two products, although there could be a difference in cost, which most likely there is going to be a difference in cost. This is where the expertise of pharmacy personnel come in, that we're able to find something which is cost effective for the patient, which produces the same effect as its counter brand name medication. So first and most important criteria for two drugs to be therapeutic equivalent is that of the active ingredient. So both the brand name and the generic variant must contain the same active ingredient in the same strength, the same dosage form, that is, it should be the same either tablet or capsule, whatever it is. Route of administration, be it oral or topical, should be identical. Also, the generic drugs must demonstrate bioequivalence to the brand name products, meaning that they produce similar blood concentration of active ingredient when administered in equivalent doses of the brand product. The labeling and packaging of generic products should meet the same basic standards as that of the brand name products. Lastly, the manufacturing quality of the generic drugs must be in accordance to the good manufacturing practices to ensure quality and consistency between the brand name and the generic drugs. Of note, therapeutic equivalent drugs do not need to have the same appearance, meaning they could look different in size, shape, or color. Their flavor could be different, packaging could be different. Also, their inactive ingredients like their preservatives or any of the other ingredients, inactive ingredients in the medication could be different. Also, the release mechanism, meaning whether it's a slow releasing or rapid releasing drug in the body, that could also be different. There could be slight or minor aspects of labeling that could vary. Sometimes one of these factors will be of particular importance to a patient, and the physician may prescribe a brand specific product. Now, there's so many medications in the market. Now, what would be the authentic source to find those therapeutic equivalent drugs? Well, that's where the Orange Book comes. Orange Book, formerly known as the Approved Drug Products with Therapeutic Equivalence Evaluations, is a publication issued by the US Food and Drug Administration, which is the FDA. And one of the key features of the Orange Book is its evaluation of therapeutic equivalence. For drugs with generic equivalents, the Orange Book will indicate whether the generic product is considered therapeutically equivalent to its brand name alternative. This information helps the healthcare providers and pharmacists make informed decisions when prescribing or dispensing medications. Overall, the Orange Book plays a vital role in promoting patient safety and facilitating the availability of safe and effective drug products in United States. Now, FDA has established a certain coding system that identifies what kind of therapeutic equivalence two drugs may have. So, all therapeutically equivalent drugs are listed in the FDA Orange Book, right? They are labeled with two letters and sometimes a number, and they always start with a code letter A, like alpha. The letter A indicates a drug which is therapeutically equivalent. If the drug starts with the code letter B, like boy, this means that it's basically not therapeutically equivalent. The second letter after the A or B gives more information about the drug. It's a little very it's a very vast topic, so we're not going to go into the detail, but the main thing that you need to understand is any product which has a code A means it is a therapeutic equivalent, but if it starts with the letter B, that means it's not equivalent. There are some controversies with the FDA approved generic therapeutic equivalent drugs. For example, some therapeutically equivalent drugs have had numerous complaints of causing more side effects and having a poor efficacy compared to their brand names. One such example I would say is Synthroid, which is the brand name for levothyroxine, which is used as a hormone replacement in hypothyroid patients. Now, many consumers complain that the generic does not work well for them. However, despite these consumer complaints, FDA still reevaluated the drugs and determined that it's therapeutically equivalent. So now it kind of falls upon pharmacy people to keep in mind such patient preferences. It is totally within the due rights of the patient to ask for a brand specific medication instead of generic. We just have to be open and upfront with the patient about the cost. Another potential problem with the therapeutic equivalent drug would be the narrow therapeutic index drug, where the dose that is therapeutic for the treatment and the dose that is not very safe are very close together. So now the worry in this kind of situation is because the effective amount and the amount that could be toxic are very close to each other. So in this case, we have to be very careful. And some of the examples of the narrow therapeutic index drugs are some anti-seizure medications, blood thinners like warfarin. Although, again, FDA says that these drugs do meet the therapeutic equivalence requirement. However, some medical organizations still make a very strong recommendation that brand medications should be preferably prescribed. So again, in such instance, we must keep provider and patient's preference in mind when dispensing the medication. And anyways, it is required by law that pharmacy communicate with the patient of any change in manufacturer or change in brand or generic. That way, it's up to the patient to decide whether they want that change or not. All right, so that wraps up today's lecture. Just remember that pharmacy technicians play a crucial role in promoting patient health and well-being. Therefore, understanding therapeutic equivalence is essential for you to ensure the safe and effective dispensing of medication. I hope you found value in this lecture, and I'll see you next time. Until then, stay safe and healthy.
Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.